what is the outcome of having a more tactile environment to learn those things in?
Sure. Well, if you ever visit our simulation center, on the wall we have a huge mural of students working in our simulation lab, and there's a statement on there that says, "Involve me and I will understand."
Hello and welcome to UNA Talks. I'm your host, Lee Taylor. Today my guest is Dr. Will Brewer. And Will, thanks so much for being here. Will is a full professor in the University of North Alabama's Anderson College of Nursing and Health Professions. He's also the director of our Simulation Center. You've worked at UNA since 2012. You've been a nurse for 23 years. What other things can we add? There's a lot of acronyms I've got here too for you that I've already forgotten what they mean, but you can tell me sort of all of your amazing credentials you've earned.
Sure. So my nursing career, I worked mainly in a large level 1 trauma center in the emergency room. I worked as a trauma team member. I worked as a triage coordinator. I was one of the charge nurses. I also was the advanced cardiovascular life support coordinator for this health system, and kind of found my way to UNA doing that, teaching. And I'm a certified emergency nurse, a certified healthcare simulation educator, and a certified nurse educator. And I teach primarily in the graduate program now. I teach in our teaching learning track, which prepares master's level nurses to teach in universities, colleges, hospitals, and then I also teach in our Doctor of Nursing practice program, primarily in our simulation and leadership in education track.
Awesome. So your hand is your thumbprint is sort of all over our graduate programs at the university. So much of our graduate programs really centered around online, and I know you do a lot of that, but you also do a lot of hands-on.
Yes.
So how do you switch gears between, teaching online? You say, you have students all over the country emailing you every day. And you also have students that are, coming to campus to work in the sim lab and of course hands-on with you. So what does that feel like to switch gears all the time and work with kind of two different types of students?
Well, thankfully I taught undergraduate nursing for 10 years here, so many years. So it's very comfortable for me. But nursing is also a field where everything is changing, and you have to be always kind of on your toes and assessing patients. And so the change is great. I like dealing with my students, all over the country, interacting with them, and then seeing our students here in our simulation lab is also refreshing, because most of the time I don't see my students face to face unless they come to graduation, because we do a lot of distance, and but it's really neat, especially to see how simulation has changed over the years, because when I was in nursing school in the very early 2000s, we did simulation, but not like we do today. We didn't have the mannequins that do all of these advanced things. We worked on each other a lot, and that's a standardized patient, and we still use that practice today. But simulation has changed so much, and that is my favorite thing, is to see all these new emerging technologies where we can best train nurses and healthcare leaders across the country.
Yeah, well, and we'll get into kind of what those are specifically. I was just over, for anyone watching who doesn't know kind of what I do here, I work in marketing, and I was just over in the Sim Center recently, and it was really amazing to see nursing students working with these mannequins who give them all of this valuable data that then they have to react to.
Yep.
And you guys can kind of turn up the dials, and
Yep.
it's a really it feels super like futuristic. It's really crazy. There's a lot of like real-time information that they have to respond to and learn how to navigate in real time.
Absolutely.
So
yeah.
really cool. So we'll talk about that in a little bit in detail, because and we'll actually be able to show our viewers some footage of
great.
that.
Great. Yeah, that's awesome.
Me and our editor talked about that earlier. I said, I think we need, we got some really cool stuff to show them, so you can really see these things in action.
Yeah.
It's really cool. But tell me about our teaching, learning, leadership it's a track essentially for the MSN program.
Right.
Tell me about that and sort of, not just the hands-on part, but really that online part. What does that program really encapsulate? What would you say is kind of the main purpose or driving purpose behind those programs?
Sure. So, I mean, obviously the main purpose is to train BSN prepared nurses to be Master of Science prepared nurses. And in our teaching learning track, we prepare them to go to a university, a community college, technical college, or even stay in the hospital as an educator. And nurses are leaders, regardless if you work on the floor, you work in a leadership position. All nurses are leaders. You have that leadership. You're a leader over that patient and of that care team. And we just continue that role in our MSN program. When you work in education you're more of a leader over the class, so say, but we also go into the hospital and you're still kind of a leader over that patient and helping make those decisions. And in our program, our MSN in teaching learning, we prepare those nurses to take on that role. It's an amazing thing to see them, because I'm at the point now in my career where I'm teaching students in the MSN program that I also taught in the BSN program. So to see them come from a undergraduate student to now a MSN student, and now I've even got some in the doctorate program that I've taught in all three levels, and it's pretty cool.
Yeah. You don't look like somebody who has done anything for 23 years. Like you've had a real breadth of experience underneath you there, which is so cool to see. Like,
I was young when I graduated nursing school.
Yeah,
I was very young.
Yeah. You out the gate, been busy. That's awesome. So tell me about how you became a nurse. What drove you toward that decision at an early age?
Sure.
Obviously, because you went straight into it and have had a really cool career along the way. What drove you to make that decision as a college student?
Sure. So I was actually in high school when I made the decision to change my major. I always wanted to be a physician. That was my goal from a young age as a child. My mom can tell you I didn't want any other toys other than medical toys, and I didn't even want the medical toys after a while. I wanted the real thing. I wanted a real stethoscope. I was born in the 80s, so that was, doctors still had the little doctor bags that they carried around, and I wanted a real one. I didn't want the toys. I wanted the real stuff, and I've always been fascinated by the science of healthcare and how we take care of patients and how things work. And my mother made me, and notice I said made me, go to work at a nursing home when I was 17 years old.
Wow.
And I literally, the only thing I did was I took trays from mealtime and served them to the patients. That's all I did as a high school student. I wasn't credentialed to do any patient care or anything, but of course I talked to the patients. I talked to them. I built relationships with them. And that summer, I had planned on going into a pre-med track at a university, and I never attended college my first semester. I went to a certified nursing course at that nursing home and became a certified nursing assistant, and just because I loved it so much, and enrolled in nursing school in January.
Wow, yeah. And from there, what was the timeline to getting your master's, and then I'd love to know about your doctorate and your dissertation, and just sort of all of them. And I know that looks different for nursing than it does maybe in other areas.
Sure.
But yeah, I'd love to know what happened next.
So I was actually an LPN, which is a licensed practical nurse, first. So if you're a nurse watching, you will realize I've literally been every step of the nursing field. I started out as a nursing assistant. I was an LPN. Then I went to RN school. I got my associate degree in nursing. While I was working in the emergency room, I enrolled in a online BSN program, got my bachelor's degree in nursing, and I knew just based on my nursing instructors and professors, I knew I eventually wanted to teach. That had always been my goal. So my master's is as a clinical nurse specialist, and it's actually in community nursing. And my further specialty with that is cardiovascular community nursing. So my project was how to keep patients with cardiovascular problems at home, how we could treat them at home, and helping them stay home if we could. I mean, obviously that's not always feasible, but if we could. And then, so once I got my master's degree, I did work in the emergency department for a short time as the clinical nurse educator. But Bertie Bailey, the former dean of the College of Nursing, she recruited me to UNA at a conference. I was speaking on nursing acronyms of all things, and she recruited me, and I started working here in the fall of 2012. And so I moved back to Florence in fall of 2012, started a new job in fall of 2012, and I enrolled in the PhD program in the fall of 2012. So I did a lot in the fall of 2012. My dissertation is on stroke patients, and I studied how nurses execute oral hygiene in stroke survivors with severe dysphagia, which just means swallowing difficulties.
Right.
And I looked at nurses actually all across the country on how we do oral hygiene, how we perform oral hygiene, because there's really no standardized procedure for that. So I looked at that in my dissertation. I did a qualitative dissertation, so I interviewed these nurses all across the country and really found some rich information with that. But ever since I've graduated with my PhD, my research focus has changed, and I look at mainly technology now and how we can use that in our simulation lab, how nurse educators can use that to better train our students and to be more present with our students. Because in 2016, so this research is almost 10 years old, it was established that 95% of all college students were distracted by a phone during a lecture. And I took that to heart because we can all be distracted by our phones. Our phones are always constantly doing something, right? But when we're in a field where everything we say in a class is important, because you're not just learning this stuff, you're learning to take care of someone's life in your hands when you work in healthcare. I really wanted to find ways to use technology, use simulation, not only in our lab, but in our classrooms to keep students motivated and to keep their attention the entire class.
Yeah. And going from sort of this traditional method of lecture, long lectures of, instead of sort of fighting maybe the downhill slope or the attention economy that we all, I think, struggle with.
Sure.
Whether it's in education, certainly in education, ask any teacher in the country, that's an uphill battle. But just in general, even in marketing, right? That's sort of a contest that you're going to lose unless you're just an expert at it.
Sure.
And I love the idea of saying, well, these are things that are so crucial, that are too important, that instead of trying to discipline that or putting these walls and restrictions around that students can sometimes get around because they just don't really understand the value of that quite yet, right? They're not learned, but they're also young and they're just figuring this out, right? So they're not aware how much of their attention is being taken, and they're missing critical information along the way. So let's just give them a reason to put the device down or focus their attention around something that really is tactile and gives them maybe better information along the way anyway. So tell me about what that looks like today. What is the how we found ourselves now in places like the simulation lab, where you're obviously really involved and doing great work every day. What does that look like today? How is that making a difference from what you can tell?
Sure. Well, when I graduated nursing school, we had computers in the hospital, but everything was paper. We wrote everything. our medication administration records were paper. We hand wrote all of our charting. Now everything is computerized. So that's one thing that we have really taken to heart is, yeah, you still need to know how to paper chart, because if the power goes out or there's downtime, you still have to need to know how to do that. But you need to also know how to use technology to help better care for your patients. So we employ all of that in our simulation lab. We have electronic medication administration records. If you've been to the hospital, you know they scan a barcode before they give you any medications. We have that technology in our simulation lab, and it's important that our students know how to use that. One of our probably biggest assets up there besides our mannequin is we have a medication dispensing machine identical to the ones they use at the hospital, where the students can actually log into this machine, choose the patient, choose what medication they want. The machine dispenses it, and they still have to check it, still have to scan it. And that was very important to me when we were building our simulation lab. You've been in our simulation lab many times, and our main focus is for you to feel like once you enter those doors, you're no longer in a college, you're in a hospital. That's what we want you to feel like.
I certainly feel that way. I think someone who's, getting their nursing degree has a lot more context and a lot more information. But when you walk in, I mean, it really is like I'm in a hospital now. And actually, I worked at a video agency before. I worked at UNA. And we partnered with the College of Nursing on a few occasions to say, hey, can we use your sim lab for because the accessibility was a lot higher than shooting in a hospital room for a medical scene.
Yeah.
That we needed for a couple of projects we worked on, because it is inch by inch, like accurate to an actual hospital setting within that building. So it's really amazing for a university our size to have something that's that robust, and we'll get into the technology of that here in a little bit too. But what is the difference that you see? Because you taught undergrad for a while, and as you have moved into these graduate programs, what is the difference that you see? As far as not only the attention that you're able to grab from students and giving them sort of a tangible, but what about the outcomes and sort of their ability to retain, a lot of these skills and practices and information? What is the outcome of having a more tactile environment to learn those things in?
Sure. Well, if you ever visit our simulation center, on the wall, we have a huge mural of students working in our simulation lab, and there's a statement on there that says, "Involve me and I will understand." And that is my motto that I instill up in all of our staff in the simulation center, all of our faculty. The simulation center, we have a kind of rule that it's a non-punitive environment. If you make a mistake up there, it's totally fine. We can press reset on those mannequins and nobody's harmed. And that is the whole premise of simulation, is to make the mistake in the sim lab, learn from it, so you don't transfer that into the hospital.
Right.
I tell our students all the time, they get probably sick of me hearing this, they have no idea how fortunate they are to have our facility to learn in, because it is top notch as far as the mannequins, the technology, just the hands-on things. And one of the things that we all love the most is seeing them come in the sim center as a very scared beginning student. They get very anxious to come in there, although we tell them, there's no need to be anxious in here. This is a learning environment. And as a graduate, they come, for their final simulation, empowered, very prepared, very confident, to where they really don't need me anymore. They needed me a lot at first, but they don't need me anymore. That's one of our biggest kind of loves in that simulation center, is to build that confidence and to build that, just that patient care and knowledge. Because in the simulation lab, I can make those patients do anything. I can make them have a heart attack if we need be. we can literally simulate anything.
Sure.
To where at the hospital, we might not always get that experience if you're not there when those things happen, because you can't really predict when those things are going to happen at the hospital. Yeah. And I can literally simulate anything I want with those mannequins.
Yeah.
And that is one thing that's really good for our students.
Hey, I hope you're enjoying our conversation with Dr. Brewer. I certainly know I am. I'm always learning something from people in the College of Nursing about things I don't know anything about. So maybe you're like me and you're learning a lot of things too. I want to take a quick break and thank UNA for sponsoring this podcast. Make sure you visit una.edu/online. You can learn about our nursing programs, our teaching, learning, leadership track that Dr. Brewer teaches, but also a lot of different disciplines that we help educate people on online at the university. You can talk with a recruiter, talk with a program coordinator, get in contact with us any way you'd like. Just give us some information and we'll let you know anything you need to know. It's una.edu/online. And if you're not following us on Instagram, Facebook, LinkedIn, X, or YouTube, hit that subscribe button, follow us, stay in contact with us, see what we're up to here at UNA. We have a lot of exciting things coming up that we want to make sure you don't miss. So now we'll get back to our conversation with Dr. Brewer. So, Will, tell me about your time. We were talking about, the sim lab is this low stakes environment for students. The point is to make mistakes so that you can see how things really work. Sure. And what those, what the consequences of our decisions are in a real time setting, without, of course, having the real life ramifications of those. Tell me about your experience going back a little bit into the emergency room, right, where that is the opposite, where it is, things can change in a flash, and we've all seen the TV shows and things like that. But what is it really like to work in an emergency room? And maybe we can, think about, how you take that into the classroom as well.
Sure. Well, my time in the ER, I think if I had to come up with one word, would be invaluable.
Wow.
Because literally you deal with every single patient population. You deal with pediatrics all the way up to geriatric patients, and every single health alteration in between. It really helped me help students also learn that life is very fragile, because you do see a lot of times where someone is having the worst day of their life in the emergency department. And as nurses, we are not only there taking care of the patients, we're also taking care of the families. We're also taking care of their support person. And that's important to me because I've always had a kind of statement that has resonated with me. I don't even know who said it, but what has become routine to us in healthcare may be the scariest day in someone's life.
Yeah.
And while all these things, the tubes, the drains, the monitors, the medicines, the medical jargon is very normal to us, it's very scary to a lot of people. And I've always made that something that I really wanted to instill up in my students is explain it heavily until the patient family member says, don't explain it anymore. I'm good, And that has been something that when I taught clinical undergraduately, I modeled for my students. I really wanted them to see that, even though they know these things, it helps comfort them for them to hear you say these things. And that's really something I learned in the emergency department as a very young nurse, is explaining and teaching and really involving everyone that needs to be in that care of that patient is very important.
Yeah. I can imagine that just the practice of empathy, the practice of removing yourself from, what some might call the curse of knowledge, right? All the jargon, all of the acronyms. This is someone's life, or you're talking to the loved one that's, the life of their family member might be in the palm of your hands.
Sure.
You need to communicate that really effectively. What does that look like, teaching those kinds of things that you learned in real time, teaching that in the classroom? How do you even kind of begin that conversation with a student in that setting?
Well, I liked to do an exercise called Becoming the Patient, where I was the patient and they had to teach me about certain disease processes. I was, if any of my former students are watching, this is not going to come as a surprise to them because they've seen this. When we learned about chest drainage systems, I actually put a chest tube like under my shirt, not actually in my chest, but under my shirt, and I simulated if that chest tube comes out, how do you treat that patient? What do you say to them? What do you need at the bedside? What actions do you need to do? Wow. And I literally would trip over a chair in the classroom. That chest tube would come out. I would have to be the patient. They would have to react to what we're doing. Talk to me. Tell me what's going on. You know, you're having to page the physician, tell them what happened, maybe even call a rapid response. And we talked about the order of the things that need to happen. And if they did it wrong, that's okay, because this is a little mini simulation in class. That's okay. We learned together, and then we might even need to do it again. And we may even need to do it a third time. But just really hands-on. And then augmented reality is something that I have really embraced in my own teaching. The students find it really cool that with my tablet, I can put an avatar right in the middle of the classroom. We see it on the screen. It's right there in front of them, but it's really not there. I've used that to simulate what happens in a heart attack, to where we have a heart literally spinning on their desk. The coronary arteries are highlighted, and we pick what coronary artery is blocked. We look at that artery on a cross-section literally in the middle of the classroom up on this screen with augmented reality. We simulate a heart cath where they're putting a catheter into that artery and placing a stent or maybe even a balloon to remove that blockage. And those students tend to put their phones down and watch what I'm doing because it's so innovative. And then we talk about the app that I'm using, because a lot of them are free, and these are things that they can use to help with their own knowledge. Our students now are they get a tablet when they enter our program. So all students have a tablet in their hand for the entire length of the program they are with us. And that's really good, because if they are a person who is, a kinesthetic learner, it has the capability to do that, but it also has the visual capability. It's a device that, a tool, I guess I should say, that we really take great responsibility in using, because we know that's what they're going to be doing in healthcare.
Right.
A lot of places do their charting on tablets. I mean, you go to the restaurant now. Sometimes they take your order on a tablet at the table. The same thing in healthcare. Nurses are using tablets to do their charting, to do their communicating, and that's important for us to simulate classroom, sim lab, everywhere, because we have our own electronic health record that simulates what a hospital's electronic health record looked like. It's obviously not real. It's a simulated piece of equipment, but it really helps our students learn that crucial aspect of nursing.
And there's a real hands-on element to all of this, of course, but there's also as far as the hands-on tactily, right? Or I think I'm saying that right, but where you literally need to know what to do with your body, with your hands to help somebody survive, or to help your patients in whatever way is necessary. And then there's these digital elements like the augmented reality, where you're seeing something that to simulate in real life is kind of impossible, but we can do it digitally, where we're sort of bridging that gap. And then we have, of course, like the soft skills and all the things that you're learning in between. What about online? So, hands-on learning, we often think about that as either that virtual simulation, the augmented reality, of course, the hands-on, or even the modeling that you did for them with the chest tube, like where that's something, these mannequins are pretty amazing, but they can't stand up and trip. We haven't gotten there yet.
No,
maybe one day. But what about online? So you're teaching so much with our teaching, learning, leadership track, and how do you develop leaders in a practical way through the internet? How do you grade that? How do you interact with them? What does that look like?
So that was the biggest question when I moved to the teaching learning track.
Because you're so used to that face-to-face.
I was so used to the face-to-face.
Right.
I was so used to being in the sim lab with the students that I was teaching, in class.
Yeah.
Because these people are nurses already.
Right.
They don't need, the patient care because they've already mastered that.
Right.
How do I simulate something for them? So I thought about it, and I look at course evaluations, I look at student feedback, what are things that they feel like they need more of? And one thing that they kept telling me, we always do an exit interview with our students after our practicum courses, is, one thing two things they always say is, I didn't realize you all did so much more than teach. Mm-hmm. That's probably the first thing they say.
Right.
And I really don't know how to act in a faculty meeting. That was kind of their thing. Okay, so I thought, all right, here's what we're going to do. So the first simulation I ever started in our teaching learning track was a simulated faculty meeting. We do it online. We do it via our electronic meeting venue that we have at the university. And that way they can actually see all of their classmates face-to-face in an online environment. They're all assigned a topic, and they're all current trends in nursing. They are things that we would talk about in a faculty meeting, whether it be a textbook change, it be accreditation, clinical site issues, just test item analysis, all these things that we teach them. And they have a certain time frame to where they have to present this. And I actually require them to do an infographic of their topic,
right.
Place it in a discussion board a little early, just like if we were doing a faculty meeting and we had a document that you needed to review, we need to give you 2 to 3 days to review that ahead of time.
Yeah.
So they're required to submit that. And the response has been overwhelming with it. Students love it. I or one of the other professors will often play like the chair of the committee. We have a secretary. We have to vote on things.
Sure.
We talk about Robert's rules, and they really love that. So that was kind of the first thing I did to implement simulation in our online environment.
Yeah, I'm sure there's a lot of anybody who works in a faculty setting or in a college setting listening to this that hasn't had that kind of training is probably saying, man, that would have been really helpful.
Yes.
But leave it to a nurse who's used to, setting up situations in which people have to respond to say, well, this is what the situation is.
Sure.
There's an occupational fulfillment here that we have an obligation to make sure that they're prepared for. And so often, people going into similar professions don't get that kind of training. They are experts in their field of study and all that, but then they have their first faculty meeting. They're like, "Oh, I didn't realize that this was going on." And there's a lot to navigate. There's likely tension at times or disagreements and things you have to learn how to navigate that really well. And it just takes a long time to learn. So you're really getting a head start with that kind. I love that mentality. I think that that's very practical and super helpful. What does it look like, whenever I guess I should ask, what is your main goal for someone in that career? So you sort of know what the outcome should be for someone who's getting their bachelor's in nursing. They need to be prepared for all of these situations and be knowledgeable and, develop all of these skills. And MSN has that and more, and the leadership skills that are attached to that. What about someone who's going into teaching nursing? What would be, or leadership in nursing, and whatever that outcome is from the teaching, learning, leadership track? what is the goal for them in your mind? Like, what is like the main marker of success for them before they enter into the next phase of their career?
Sure. Well, of course, we have our program outcomes that we are going to, they're going to meet. But I really want to empower my students with a toolkit of information that they can take with them and grow. Mm-hmm. I've given you these things in our classes that you learn. One of the classes I teach is our evaluation class, and it talks about, how to create a rubric, how to do test item analysis, how to evaluate a student who is in clinical, in the sim lab. And I like to give you that practical toolkit to take with you to where you have something to start with. And then as you continue to practice, you grow that. Each week in our teaching learning students in our practicum classes, I do a micro learning for them over some type of innovation, because we have to put innovation in our classrooms. We have to. So like this week, mine was on just an app that I found, and it talked about the different types of viruses and bacteria, to where, if you're teaching pathophysiology to undergraduate students, here's a great resource. Tell them this is free. Download this if you have it. Right. Just little mini burst of information to where they can build their toolkit, and hopefully, when they do go into their practice, they have this beginning knowledge to where they can build on it. They can teach these students to care for patients, because, one day we're going to need someone in healthcare, right? Whether it be at a routine doctor's visit, whether you be in the hospital. And I always look at it as that, because these people are going to be caring for my family. They may be caring for me. Sure. And we want them to be the best that they can be. Right. When my wife had her baby, our baby last year, there were so many students that I had taught in the hospital. And that was really cool to see. And they were a little nervous for me to be in there. And but anyway, I was like, look.
I'm sure, right?
I was like, look.
The stakes were already high,
yes,
but now here's Dr. Brewer.
I'm not a maternity nurse by any means. So I was like, I'm not here watching you, doing everything that you do. But it was just really cool to see them implementing things that I knew we taught them in the College of Nursing. I don't teach maternity. Obviously, I'm not a maternity nurse by any means, but basic things transfer everywhere. It doesn't matter where you are. And just to see them implementing these things was just really cool.
Hey, I hope you're enjoying our conversation with Dr. Brewer. I wanted to just take another quick second to thank UNA for sponsoring this podcast. I want to make sure you go to una.edu/online when you have a moment to check out all of our online programs. You can talk with our program coordinators and talk to our recruiters. Just let us know some information. Let us know what you're interested in, and we'll help you out. So make sure and check that out. We also have scholarship opportunities, partnership opportunities, all sorts of things that we list there. And also follow us on social media if you haven't already: Instagram, Facebook, LinkedIn, X, and YouTube. Of course, now that we're doing this kind of cool stuff on YouTube, so I want to make sure we plug that. Subscribe, like, all that good stuff. But thanks so much, and we will get back to our conversation with Dr. Brewer. So you guys love to brag about the specific technology that we have, so I'll let you really nerd out for a second about these mannequins. And yeah, whenever I say that, I've been to the sim lab a few times. I talk with professors and department chairs and program coordinators all across the university, and I'm probably the least knowledgeable about the College of Nursing because it's just so esoteric. It's so specific. It's such a fascinating field of study that if you're not in it all the time, there's really no reason to know a whole lot about it.
Sure.
And being around this technology and seeing students interact with it taught me a whole lot about exactly what it is you guys do and what your goals are.
Yeah.
It taught me a whole lot more than I had anticipated learning that day. So tell me specifically, about what this technology is, what it does, how it works, and sort of the array of tech that you have.
Sure. I'll just start by when you enter the sim lab, we actually have machines that make the environment smell like a hospital. So we have things that we can disperse out that smell like different scents that you would smell in a hospital. So the first one we put in there is just like a clean smell. It smells, like that kind of disinfecting smell that a hospital has. We can actually put that out to where right when you walk in the door, it hits you in the face. Because, smells you associate with things.
Oh, sure.
And that's a big part of simulation is, we do something called, like suspending the disbelief that we all know this mannequin is not real.
Sure.
Everybody up here knows that's not real. But we ask that while you are here in our sim lab, you treat everything in here as it is a real patient, real medication, because while those medications look very real, they are nothing more than distilled water and sugar tablets.
Right.
That's all they are. There's nothing real up there as far as medicines. But we just ask the students to treat those things like they are real. So we have hospital beds. They are real hospital beds.
Mm-hmm.
They will weigh the patients. And learning to work a hospital bed is an art. They're not just move the bed rails up and down now. They are very specific. We have a critical care bed that they use in cardiovascular ICUs, intensive care units, to care for very sick patients.
Wow.
We have one of those beds up there. We have a labor and delivery bed. We have those newborn isolettes. Our furniture up there is very specific to hospitals, the over-the-bed tables, the bedside tables, all of that. If you look on the head walls, if you cut the oxygen on, it's going to work. Mm-hmm. It's not real oxygen in our sim lab. It is compressed air, but it simulates that real oxygen. If you cut the suction on, it's actually going to suction. And that was very important to me when we were building the simulation lab. I was fortunate enough to be able to help say what went in there, help with the plans, and to help with the implementation of all of our stuff up there. And that was one thing that was important to me. It's not real if you just act like you're cutting something on. You need it to actually work.
Right.
So we've looked for so many different things. If you put the thermometer in our mannequin's mouth, we control that value on an iPad. You're actually going to get a value on the thermometer. If you take a blood sugar on the patient, we have these little kind of like little finger cots that put on the finger.
Right.
You will actually get some blood out. You put it on our glucometer. We control it with our tablets, and you will get a value of whatever we want it to be for that simulation.
Right.
And that was important to me. The mannequins are also very high fidelity mannequins, meaning that they are the most realistic thing you can get to a real human.
Right. The first time I noticed that one blinked.
Oh yeah.
I kind of
yeah.
It gave me I'm not gonna lie, it gave me a slight chill. But then I moved on, and it was like, yeah, that's the point. Like it needs to feel like a real person. Like and it talking about empathy and like showing respect toward these tools and treating them as real patients. It's those kinds of things that remind the student that what's in front of them and what they're really dealing with. I thought that was really fascinating.
Absolutely.
Yeah. And
if you look really close, those mannequins, when they blink, we can actually make them cry. They can sweat.
Really?
If you shine a light,
That's
it's pretty cool.
Yeah.
If you shine a light in their eye, their pupil's going to react to the light. They have body fluids, so they can urinate, they can vomit, they can bleed if we need them to.
Yeah. We didn't film that part, so maybe that wasn't good for camera. So that's interesting.
But that is important for us.
Sure.
When we are teaching these students these skills, if those reactions are going to occur, it's important for us to make them occur.
Wow.
And these mannequins can do that. In our sim lab, one side is primarily focused on adult health. So just, we have a med surg room, we have an intensive care unit, we have a community room, because that's one thing that in a BSN program is we teach community nursing. And it's set up like a home, because our students go into home health environments, they go into clinics to take care of patients. So that's one thing we were very passionate about in that simulation lab, is having that room. And then we have another room on that side that can really be used for anything. We use it a lot for kind of like another ICU or a progressive care room. And then on our other side of our sim lab is our maternal child side. So we have a postpartum room, which is like post-delivery. We have a delivery room with that realistic delivery bed, even has the lights in the ceiling, just like the delivery rooms have at the hospital. And that's important because these pieces of equipment are going to be used in a real situation, and we want them used. We also have a newborn nursery where we have, the warmers, we have the bassinets, we have 2 regular-sized babies, but we also have a 27 to 28-week gestation premature model that we can use to simulate a baby that would be born early. And then we have a pediatric room where we have kind of 2 toddler mannequins that we use, and then we have 2 child-sized mannequins that we use for that. And then we also have our medication room where we have supplies. We have our medication dispensing device. We have 2 working crash carts, emergency carts. We have a pediatric one and we have an adult one. One of our defibrillators on there is actually a tablet in a plastic box, and it simulates a real defibrillator so well. But nobody can get shocked with it accidentally because there's no electricity connected to it because it's a tablet.
Oh, wow.
And that's important for safety for students as well when they're learning to use that. Our IV pumps, that's a skill that is very important to us, that our students know how to use pumps. So we have pumps, because there's many different brands. We have pumps that are represented at every clinical facility we take students to, so they have the ability to actually touch the tubing, prime those IV bags, set the pumps up, and before they even step foot in the hospital, they can do this. And that can get a little costly, because once you use a set of tubing, it's really hard to reuse it because there's fluid in it. But we are very passionate about our students using this stuff, getting their hands on it, and we are fortunate enough to be able to do that for them. We have our control rooms where we have our camera system where each room has a camera, because we have to watch each skill to make sure it's correctly. I mean, you can zoom in and see the veins on someone's hand so close if you need to. That's how we talk to the students as the patient. We have a centralized phone system, so if they have to call another department, they have to call a physician, they're actually calling someone.
Right, they're not shouting down the hallway.
No, they're not, So they're actually calling someone. And so we partner with the medical residents from the local hospital, and they're actually our physicians a lot of times on the phones, and they will go see the patients. And that's just part of our, interprofessional collaboration. We use our respiratory care students in there as the respiratory therapist. And that's so much more meaningful than someone pretending to be that profession, because it's actually someone in that profession. And we're very passionate and very focused on making sure we do that with our students. And it makes it great when they are programs housed in our own college. So, and then, we have computers that control the mannequins. We can do pretty much any value of anything we want. We can change their blood pressures, their heart rates, pretty much anything. I'm sure you saw when you were there, but their chest actually rises and falls when they breathe, and we can simulate lung sounds, heart sounds, just really anything at all.
No, it's really unbelievable, and it's it's hard for somebody like me who's like, I don't know how common these things are, or, like you may be able to buy one of these at Target and I just don't know, but turns out not the case. Like it's an incredibly, I can say that on your behalf that it's an incredibly advanced, really world-class simulation center that is, for all the principles that we talked about how important it is to use technology to engage the student, but not only to engage them, but to practically equip them. There's not a better example of that on our campus, and there's hardly any campus in this country than our nursing sim lab. It really is that impressive and that formative, and
Sure.
it's really an incredible thing. So love the work y'all are doing. Love how thoughtful every piece of equipment is. That there's a lot of ways that you can maybe say, well, that's going to be an added expense, or that's going to be something that it's going to be really hard to maintain, and you guys really fight for that and continue to maintain this place to be fully functional and fully educational in every aspect. So a lot of advocacy there,
definitely,
on your end, that we appreciate, and I'm sure our students even more. What do you think? What do you think the future of this looks like? Like, you've seen, because you've been doing this a long time now, you were talking about your experience as a student, with just everything was a handwritten chart and you were practicing on each other, to now everything's digitized, and the simulations are way more complicated and vast and expansive and instrumental. Where are we headed next? Where is this profession headed next, and where do you see UNA sort of fitting in the College of Nursing, especially,
Sure.
of course, fitting into the spectrum of that and preparing students for what the future is?
I think we are driving technology a lot as a College of Nursing.
Sure.
I can't exactly remember how long our students have had tablets in their hand as far as getting that when you enter the program, but I believe it's been 2 years now. That was kind of a new concept on colleges. Students have used tablets for a while, but actually getting a tablet when you enter the program, that was kind of, some new territory that we had to embark upon. But it has proven to be a great tool for them, and I think we're just going to keep forging that way. Mannequins are now being released using artificial intelligence to talk back, to where I don't have to be the voice of the mannequin anymore. AI actually responds to what you say, AI tracks the head. So these mannequins now, their heads will move in what direction you move, and they will look at you. And that is great because that's real life. We're just going to see everything evolving with AI, and one thing that I really, really focus on with AI is how can we use it for good, and how can we use it to better take care of patients. And AI is here. It's not going anywhere. It's here. We need to embrace it. AI has been around a while. It's not really, some of the things of it are new, but it's been around a while.
Sure.
But that's one thing we are really doing is, how can we teach students to use it responsibly and use it in healthcare to better care for patients, and just always looking for what is new, what's out there, what do we need to make sure our students have that will make them the best possible nurse educator, nurse leader, nurse practitioner that they can be. I mentioned the IV pumps. Those things change a lot. It's important for us to make sure that if a new version comes out and the hospital has that new version, we need to make sure we're looking at the budget and seeing if we can get a new one. Can we trade in some of our old ones to get one of these new ones?
Sure, yeah.
And that's very important. It's one of those things. It's just like healthcare. It's always changing, so you always have to be kind of on your toes looking, and that's what I like the most about it is, there's something new being released all the time. we have these masks that we can put on our mannequins that look so realistic. They even have little hair on their ears. They're hand painted. They take about 14 weeks to make. They're so realistic.
Oh, wow.
You can even wear them. Like, I sometimes will put them on if I'm a standardized patient and people have no idea who I am. The former provost, when we first got them, the dean that retired, she took me to his office, and he had no idea who I was because I was in that mask. So, I mean, we have so many cool and emerging things that we use to help our students just be the best nurse that they can be. And I think that's where we're going to continue to go. We are embarking upon some new programs in like occupational therapy. And
talking with Laura Smith.
Yeah. We're seeing, how we can incorporate their students into simulation. Recently, within the last year, we have purchased virtual reality goggles where students can treat virtual patients, and they can actually learn skills like IV insertion. They can do like head-to-toe assessments, medication administration, and we're starting to use these to help students learn how to prepare for their checkoffs. It's that kinesthetic thing, going through those motions and really honing in on how to be a safe provider. And the VR is just, it's very fascinating to me because I love AR so much. Augmented reality, virtual reality is just, it's very fascinating to me. I will say the first time I put on the goggles, it was a little queasy. Like I had to get used to it.
Well, you'll have a generation of students likely soon that have grown up using it so often, not even in school, but just like in gaming and all these other applications. That my daughter's 8 years old and said something about went to the library and wore one, and it just kind of blew my mind because I was like, if you had told me that was going to exist when I was 8 years old, I mean, I wouldn't have I just had no concept of that, So you'll have this generation of students that will be maybe second nature to them by this point. So.
We're seeing that already.
Yeah, sure.
And one of our faculty members, her son actually helped us set him up because he had one already, and he knew what was going on, so he helped us. And it's really just, the sky's the limit of what we're seeing with technology and with just ways to train our students to be, like I said, be the best they can be.
And it sounds like you're not only kind of reacting to what those trends are and what hospitals are doing, but you're leading the way. You're showing what that can look like in a learning environment. Really, raising the bar for other schools. Our College of Nursing is just so advanced and innovative in that sense, and you guys leave plenty of room for that. But no, it's so cool. Will, it's so great talking to you about all this stuff. We could keep. I'm sure you could list even more of all the tech that you guys are doing. But I think the real takeaway for me and sort of what I'm learning about the way you think and the way everyone in the College of Nursing really thinks is, really utilizing technology as a means of engagement and not seeing it as an obstacle. Right. And I just think that's so important, especially in the field that you guys are in, but really just in the world of education is something that we're all, kind of learning how to do. So really appreciate your insights on that.
Thank you for having me. I appreciate it.
And thank you for listening and for watching. We appreciate it. Come back soon. We'll be back with more, talking with more amazing professors across the university about really cool stuff. Thanks.